Good afternoon. I'm Dr. Emmanuel. I'm an infectious disease consultant physician and recently started working at the Mafraq Hospital. I trained and worked in the UK, in Liverpool, at the tropical and infectious disease unit of the Royal Liverpool Hospital, and also worked as a health lead, a national lead for sepsis in the English National Health Service. So it's a pleasure to be now working in the Mafraq Hospital. I also worked at the Liverpool School of Tropical Medicine, which is internationally known for tropical medicine research and also services. So what I'm bringing to Mafraq Hospital is high-level specialist infectious disease services to Mafraq, and that involves prevention as well as treatment of infections. So people who are traveling abroad can have access to specialist advice before they travel to prevent them from getting infections acquired in other parts of the world. But also patients with complex infections, patients with infections, for example, acquired in the UAE, such as pneumonia, meningitis, or skin infections, now have access to specialist infectious disease services in the Mafraq Hospital, as well as infections acquired in hospital, the healthcare hospital acquired infections. So all complicated, all complex infections will be able to provide that service. I want to specifically talk to you about resistance to antibiotics and use of antibiotics in the community as well as in the hospital. Now, antibiotics are a great resource. They help us to treat infections and they save lives. But if we don't use them well, we run into antimicrobial resistance, antibiotic resistance. So every year, 1 million people around the world die as a result of resistance to antibiotics. And we've got to change that. And the main reason is antibiotics not used well. So we've got to improve the way we prescribe antibiotics so that it's only those who need it get it. And we also have to make sure that those who need it get the right antibiotics and for the right amount of time. So don't put pressure on your doctors to prescribe antibiotics so that they shouldn't prescribe it if you don't need it. Viral infections don't need antibiotics. And if you have an abscess, it can be drained and treated without antibiotics. So remember, antibiotics are not always needed, and when you're prescribed an antibiotic, make sure you take it as prescribed and finish your course of antibiotics. And we're going to be working on ensuring that doctors only prescribe antibiotics when it's necessary, prescribing the right antibiotics and for the right amount of time. Thank you.